Video lecture Chapter 15, Legal Issues and the Dental Radiographer. Legal issues and dental imaging. Laws exist that govern the use of ionizing radiation in dentistry. The dental auxiliary must be informed of and comply with these regulations. The possibility of negligent care exists when dental images are not properly exposed or used. We'll speak of federal and state regulations and licensure requirements. Federal government requirements include safety precautions affecting the use of dental x-ray machines made and sold in the United States. Licensure requirements may include obtaining additional certification in dental imaging, performing dental imaging procedures only under the direct supervision of the dentist, and following restrictions concerning the type of dental images that may be legally exposed. Risk management, malpractice issues, patient records, and patients who refuse images. Risk management includes the policies and procedures that should be followed by the dental radiographer to reduce the chances that a patient will file legal action against the dental radiographer or the supervising dentist. Informed consent, self-determination. Persons seeking healthcare services have the legal right to make choices about the care they receive, including the opportunity to consent to or to refuse treatment. Information presented to the patient should include the following: purpose and potential benefits of the dental images, person responsible for exposing the images, number of and type of images, possible harm that may result if the images are not exposed, risks associated with X-ray exposure, and alternative diagnostic aids that may serve the same purpose as the images. Disclosure, the process of informing the patient about the particulars of exposing dental imaging. Informed consent, defined as consent given by the patient following complete disclosure. Purpose of procedure and who will perform it. Potential benefits of receiving the procedure. Possible risks and opportunity to ask questions. Liability. Dentists are legally accountable or liable to supervise the performance of dental auxiliaries. Dentist and dental auxiliary may both be sued for the actions of the dental auxiliary. Malpractice issues. Malpractice results when the dental practitioner is negligent in the delivery of dental care. Negligence is when the diagnosis made or the dental treatment delivered falls below the standard of care. Standard of care is the quality of care that is provided by the dental practitioners in a similar locality under the same or similar conditions. Statute of limitations is the time period during which a patient may bring a malpractice action against the dentist or auxiliary. It's the responsibility of the dentist to review and report all information presented on dental images and acquired data sets. Patient records. Documentation included informed consent, number and type of images exposed, rationale for these dental images, an imaging report including diagnostic information obtained from the interpretation of images, and confidentiality. State confidentiality laws protect information. Ownership and retention of dental images. Legally, dental images are the property of the dentist. However, patients do have the right of reasonable access to their records. Dental records and dental images should be retained indefinitely. For patients who refuse exposure of dental images, the situation must be carefully considered by the dentist. The dentist must decide whether an accurate diagnosis can be made and whether treatment can be provided. This will conclude our lecture.